Well, back in early August, I fell off a ladder when I was doing some gardening, and I realized I couldn't get up. The knee was going one way, the leg was going the other, and of course it required an ambulance. I was placed in the hospital because I had fractured the head of the tibia and my knee, and I had soft tissue damage. I was in the hospital for 12 days, and following that, I was sent home.
The Home First program allows people to leave hospital as soon as they're medically stable. It allows them to go home with an increased amount of services to continue their recovery at home.
Other than being in bed full time and enjoying hospital meals, I just felt that I could probably look after myself better at home, and I would recover better at home. And then when I got there, I realized that I didn't know as much as I thought I knew, and that's where this program came in. That helped me so much. It helped me be very realistic about my recovery and how I was going to recover.
The philosophy is front load the services, get that person home, help with their crisis situation, get them settled at home, allow them to adjust, make changes, recover, and then slowly pull back the services according to their need as they recover.
The Home First program is making sure that the patient receives the right care in the right place at the right time. The philosophy with it is that when patients are ill and require acute care, they should be in hospital. That's where they need to be. But after that care has been provided and the patient's feeling better, they need to be back home where they belong.
So when I first met Penny, she was concerned about going home, and she needed a little bit of reassurance in terms of how we were going to meet her needs at home. So the barriers that were presented were very valid in terms of stairs in the home, non-weight bearing, you weren't comfortable on crutches. The home was not suitable, but we put in every little gadget we could find to make it suitable. Her husband's ability to assist her at home. The services that we put in to sort of fill the gaps for toileting and for bathing and those sorts of things. Her ability to adjust all those things is a perfect recipe for a difficult situation.
Well, both my boys live out of town, right? And my husband is a 3-time cancer recoverer, so I am the caregiver in the family. So for him to take over the role of caregiver was a very frightening situation. He didn't know what to do for me, and walking up and down the stairs frequently for him to be able to help me. So having a caregiver come in, I think helped him feel better about things. They were able to help him and to reassure him. So we realized that between the two of us, we still needed more help.
The benefit of Home First in Penny's case was I wasn't limited to a prescribed amount of service. So we all really didn't know where it was going to go.
That's right.
So in her case, she needed more attention and more assistance to make the recovery happen at home.
When you're home, you're able to rest, and your family's able to rest. They feel more secure when you're home too, because it gives them the sense that, okay, she's on track, now she's going to get better, everything's going to be okay.
For Home First to be successful, we need the collaboration of essentially everyone involved in the patient's care, starting first and foremost with the patient and addressing what they are concerned about, what they, where they wish to be, where they wish to be cared for, and in what way. Spreading from there would be from the nursing staff and the physicians within the hospital who are helping them get ready to go home, or to provide them care right away in order for them to go home directly from the hospital. Then it's up to the family, the patient, and their family physician in the community, as well as home care workers delivered through the CCAC, to continue that care and to continue to collaborate in order to provide the patient with their best care.
It's all about feeling comfortable and feeling, just the feeling knowing that you are going to get better once you get home. That makes all the difference in the world.